So here's Dr. Devin Coughlin from Revolution Health Center, and I'm here to talk to you today about ear infections, or commonly called otitis media. So when we look at the picture here behind me, you're going to see chiropractic care for otitis media or ear infections. And what we're seeing here is really the number one visit the number one reason for a visit that a child goes to a pediatrician right now is for ear infections. And some symptoms that a lot of people will detect their children having with that are, pulling at the ears, excessive crying, fluid coming out of the ear, all different things like that, not sleeping well, fevers, headaches, irritability, sometimes even hearing loss or hearing problems. Parents are noticing that their kids aren't hearing them when they speak to them. And so really what's happening here is, I just want to kind of share with you a little bit about the anatomy of the upper neck and why that's happening. A lot of parents have experienced this where they're going through round after round after round of some sort of medical treatment and it's not working or getting results. And so let's kind of dive into what's happening. So if we look, this is obviously the external ear here. This is the ear canal going in. The middle ear is right here. That's the part that gets most commonly irritated or infected with that fluid being in there. And then you're going to see this part here called the eustachian tube. So a lot of people are familiar with that term. Now, what happens here is we get fluid in our middle ear. That's normal. And so that the way that fluid drains out of the ear is down the eustachian tube into the lymphatic system and out of that area. And what you're going to see is a lot of people understand that that's normal. You've probably even heard before that children have more horizontal ear canals, or the eustachian tube actually is more horizontal. As we get older and become adults, it becomes more vertical, so it drains more effectively. But when it comes to children, they might have an ear infection, not know it's not always painful, but what we're looking at there is an abnormal buildup of fluid that becomes infected. And so let's go over how this process happens. So children, they actually will begin this process with a cervical spine subluxation, or basically when the spine shifts out of alignment. So if I have a shift out of alignment of my top couple bones, either C1 or C2, it can actually cause a problem in the upper neck that can cause nerve irritation, also muscle spasm. So I'm just going to put that down here and just kind of go through the chart, but that's cervical spine subluxation, which can happen from jumping on trampolines, roughhousing, learning to walk or crawl. A lot of kids are going to have falls. I can tell from experience. My wife and I got a trampoline. My children were out there jumping on it, and literally my son came inside and started complaining of ear discomfort. And so this is what we did. So we said, okay, we had this cervical spine subluxation. What happens there, it actually causes muscles that attach to the eustachian tubes to contract. So when the spine comes misaligned, the muscle goes into spasm there. When that muscle spasms, and that muscle attaches right in there, right where the eustachian tube meets the middle ear, that eustachian tube can become pinched or occluded. And when it becomes pinched, now all of a sudden that fluid's not draining out of there properly. Then we get that fluid build up in the middle ear. And when that stays there long enough, what happens is either bacteria or a viral infection can ensue in that fluid. And so what most people do, like I mentioned before, they'll actually take their kids to the pediatrician. And when they go to the pediatrician, they're going to get treatment with antibiotics, most commonly amoxicillin. Now, the problem with that is that pediatricians themselves know that viral infections don't respond to antibiotics. But really what's been happening now is that parents are demanding these because they know it's going to create some symptomatic relief. So what happens is they'll get the antibiotic. Now again, antibiotics do not treat viral infections or inflammation, which is what's happening there. Then that fluid persists because the eustachian tube is blocked. Again, we're not trying to treat the bacteria or the virus. We need that area to clear out so the fluid drains. That's the most important thing to understand. So the eustachian tube remains blocked, which then allows the virus to remain. Or if, let's say there was a bacterial infection there and the antibiotic knocked it out, what happens is because that fluid stayed in there, bacteria can now regrow. And from there, we end up back where we were before with the infection. So a lot of people have experienced that, where you get that cycle of ear infection, antibiotics, symptom goes away, and then it comes raging back. And so the problem with that is it was never treating the cause, it was just treating the symptom, which again is the ear pain coming from the fluid that built up in there. So just to recap, what happens, what starts this whole process is some sort of spinal misalignment. Typically it's C1 or C2, the top two bones of the neck. The muscle becomes spasmed, which again then occludes the eustachian tube, preventing the fluid from draining out of there like it's supposed to. It becomes infected, and then all of a sudden we get into this cycle of recurrent ear infections. A lot of times this ends with a child having tubes put in their ear to do what? To help it drain. So you ask yourself, well, why didn't we do that from the beginning to help it drain? And again, what we're saying is that the better alternative, the better, more effective, long-lasting solution is actually to address the subluxation and avoid that muscle spasm, that whole process. All right, so hopefully we took care of answering that question. Again, you know, it's not an antibiotic issue, it's a drainage issue. So that's all we have for today. We'll see you next time on Revolution Health Center's next video series.